Hi, my name is Paige Cox. I am a nursing student from the University of St. Francis. Can I please have your name and date of birth? I'm checking her ID band. Okay. Well, it's nice to meet you. I'm here to do a postpartum assessment on you. Is that okay? She says it's okay. So now I'm going to perform hand hygiene. And while I rub this in, I'm going to ask, are you in any pain today? Can you rate that on a scale of 1 to 10? She says that she is in no pain today and rates her pain as a 0 on a scale of 1 to 10. First off, I'm going to start with vital signs. I'm going to take her blood pressure. Okay. I heard her blood pressure at 128/82. This is normal blood pressure. Next, I'm going to take her pulse and her respiratory rate. I'm doing this by palpating her radial pulse on her wrist for 1 minute. The first 30 seconds, I would actually check her pulse with watching my watch, and then I would, in the next 30 seconds, I would watch her chest rise and fall to get her respiratory rate. I would say that her respiratory rate is around 15 respirations per minute, and her heart rate is at 86 beats per minute, which is both normal. Next, I would get a temperature. For moms, we do an oral temperature. Under your tongue, please. Her temperature says that it is 95.0 degrees Fahrenheit, and this is the end of my vital signs. So next I'm going to move on to auscultation. I'm going to listen to her, both sides of her lungs, front and back. I would ask her to lean up. Then I'm going to listen ape to man across her chest and end at the apical pulse, where I would listen and also compare it with the radial pulse to make sure that they are equal. And then I would auscultate her bowel sounds in all 4 quadrants and make sure that they are active, especially post C-section. We want to make sure that mom's bowel sounds are moving. So everything seems good. I would say that her breath sounds sound clear on both sides, front and back. I heard her apical pulse match her radial pulse, which is good, and bowel sounds are active, and she has stated that, next I'm going to do a head-to-toe assessment using the acronym BUBBLE-D. So the first B stands for breast. So first I'm going to say, is it okay if I go ahead and do a breast examination on you? And she's gonna say it's okay. And then I'm going to apply my gloves. I would apply gloves here. And then I'm going to take down her gown, and I'm going to inspect first, noting that her nipples do not look inflamed, they're not cracked, they don't look dry. Are you having any pain in your breast or any tenderness, any warmth or swelling that you've noted? And she says no. I'm then going to use my 2 fingers to palpate in a circular motion around the breast, feeling for lumps, hard spots, and asking her again, do you feel any tenderness while I'm palpating your breast? And she says no. Then I'm moving on to uterus. Again, still with gloves on, I am going to tell her that I'm going to be palpating her uterus. This shouldn't hurt. Let me know if it does though. So with one hand, I'm going to place the hand just above the pubis bone to support, and then I'm going to take 2 fingers around the umbilicus to find the fundus, which is the top of the uterus. So I feel the top of the fundus about 2 fingers below the umbilicus, which is fine. The fundus feels firm, not spongy. I'm asking her about any pain. The uterus feels midline, which is good. Then moving on to the 2 next B's, I'm asking her about bowel and bladder. Have you had a bowel movement since giving birth? She says no. That's okay though, because you did give birth within the last 24 hours, and you had a vaginal birth, which constipation is tricky after birth, but we still want to prevent it. So ways that you can prevent constipation is to go ahead and if your nurse offers you a stool softener, take it. If you can get up and move around or do range of motion exercises in bed, that will help you. And drink lots and lots of fluids and make sure that you get a high fiber diet going on. Next, I would ask her about her bladder. Have you been able to urinate since giving birth? She says yes. I would ask her about any burning, urgency, blood in the urine, and I would teach her that these are signs of a UTI and that if she does start experiencing these signs, she should report it to her nurse. And also I would let her know that, some moms after they give birth feel hesitancy and fear about having a bowel movement or using the bathroom. This is understandable. A way that you can get your urine flowing is to go in the shower or splash some water on your labia and some warm water to get that flowing, and to just let her nurse know if she sees any signs of the symptoms of the UTI that I had just presented. So next is losha, which is the bleeding that happens from the vagina after birth. So the first thing I'm going to do is I'm going to let her know, hey, I'm going to pull down your pull-up that you have on right now, and I'm going to check out the bleeding that we have. My first question for you is, when was the last time that your pad was changed? She's going to tell me that her pad was changed an hour ago. We track the amount of blood that, the amount of losha that occurs by hour, so I would document by hour. So I'm noting a moderate amount of bleeding in the pad. I don't see any clots. The blood is red with some darkness in it, but I don't see any clots in it. Another teaching point here is teaching about hemorrhage. Some signs of that would be soaking through your pad within an hour, so less than an hour, and large golf ball sized blood clots, so about that big. If you see those things, either or both, you should let your nurse know immediately because it can be signs of bleeding, which we don't want. Next, I'm going to move on to E, which stands for episiotomy. I would have mom turn over on her side, which might not be possible, but I would have mom turn over on her side, and using my pen light, I would pull down the back of her diaper and I would use the pen light to inspect. I'm using the acronym REDA, which stands for redness, episiotomy, redness, edema, ecchymosis, drainage, and wound approximation. So I'm looking to make sure that the wound, the edges of the wound are together. There's no drainage, redness, swelling, blueness, discoloration of any type. While I'm down there, I am looking for hemorrhoids. I would do this check even if the mother had a C-section, just because pregnancy can cause hemorrhoids. Next, I am also checking for the spot of the epidural. I'm making sure that that wound does not have any drainage, redness, or signs of infection. Then I would have mom turn back over. I'm now moving on to DVTs. I'm letting mom know that while leg soreness after birth is super common, one-sided, so unilateral redness, warmth, and swelling and pain is not normal. I'm asking her if she's experienced any of these things, and she says no. I'm inspecting and palpating unilaterally. I can note some edema after birth, that's normal, but if one side is exponentially different than the other one, then that would be signs of a DVT. A teaching point here to prevent DVTs would be to use SCDs whenever your nurse says to, as well as getting up and moving around, drinking lots of water, just generally doing range of motion exercises when possible. The final thing that I'm going to do is I would review all of the teaching that I have done in this assessment, which would be signs of a UTI and prevention, how to combat any hesitancy or worry that the patient might be feeling about both bowel and bladder movements. I would talk about hemorrhage, and I spoke about preventing clots. Then I would go ahead and make sure that mom doesn't need anything, which she says she doesn't. I'm going to make sure that she's comfortable, give her call light, provide privacy again by closing the door whenever I leave. I would doff my gloves, do hand hygiene, and then I would go and document about the mom's emotional state during this assessment, which I feel that she was calm, a little tired, but that's to be expected, and that she wasn't in any pain. So, thank you.